Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is the mechanism of action for Ubrelvy? The mechanism of action for Ubrelvy, generic name, ubrogepant, involves the blockade of a nerve protein called calcitonin gene-related peptide, CGRP, that contributes to migraine headache pain. Ubrelvy is used to treat an acute migraine, with or without auras, once it starts. It is not used to prevent a migraine. An aura occurs in about 20% of people with a migraine headache. An aura involves sensory changes such as bright lights, blurred vision, an unusual smell, an unusual sensation or feeling, trouble speaking, and numbness or weakness in your body. It can let a patient know that a migraine is starting. Is Ubrelvy a CGRP inhibitor? Yes, Ubrelvy is a CGRP inhibitor. There are two types of calcitonin gene-related peptide, CGRP, inhibitors, monoclonal antibodies and CGRP receptor antagonists, also called gepants. Ubrelvy, ubrogepant, is classified as a CGRP receptor antagonist, gepant, a small molecule drug which blocks the CGRP receptor. It works by directly blocking the CGRP protein from attaching to sensory nerve endings that lead to blood vessel dilation, pain and inflammation in a migraine attack. Monoclonal antibodies target either the CGRP protein itself or the CGRP receptor. A monoclonal antibody is a group of identical proteins that only target one substance in the body. Which CGRP inhibitors are used to both treat and prevent migraines? Some CGRP inhibitors are approved for the treatment of migraine headaches, some are approved for the prevention of migraine headaches, and others are approved for both treatment and prevention. CGRP inhibitors, gepants, approved by the FDA include Nurtec ODT, rimegepant sulfate, oral pill used for migraine treatment and prevention. Clipter, attackMonoclonal, oral pill used for migraine prevention. Ubrelvy, ubrogepant, oral pill used for migraine treatment. Zavsprit, zavegepant, intranasal spray, nasal spray used for migraine treatment. CGRP inhibitors, monoclonal antibodies, approved by the FDA include Aimovig, arenumab, subcutaneous, under the skin, injection used for migraine prevention. Ajovy, fremanezumab, subcutaneous, under the skin, injection used for migraine prevention. Emgality, galcanezumab GNLM, subcutaneous, under the skin, injection used for migraine prevention and acute treatment of episodic cluster headaches. Vyepti, eptinezumab JJMR, intravenous, infusion injection used for migraine prevention. What does Ubrelvy do for migraine pain? In clinical studies, patients took Ubrelvy within 4 hours from the start of their migraine headache. Both the Ubrelvy 50 mg and 100 mg dose led to more relief from pain and the most bothersome symptoms, like light sensitivity, sound sensitivity, or nausea, at 2 hours, compared with the group using a placebo, an inactive treatment. Pain relief was defined as a reduction in migraine pain from a moderate or severe level before treatment to mild or no pain after taking the Ubrelvy dose. Related questions: Ubrelvy versus Imitrex, sumatriptan, how do they compare? How often can you take Maxalt? How long does it take for Maxalt to work? How fast does it work? In Ubrelvy studies, about 40% to 43% of patients experienced migraine pain relief within 1 hour, compared to 37% taking an inactive treatment called a placebo. Over 60% of patients had complete relief within 2 hours of treatment, compared to 49% of those taking a placebo. If needed, your healthcare provider may combine Ubrelvy with other migraine treatments, such as NSAIDs, triptans or preventive agents like beta blockers, antidepressants or Botox. Related, is Ubrelvy better than triptans? How do I take Ubrelvy to stop my migraine pain? Ubrelvy comes as an oral tablet. The recommended dose of Ubrelvy is 50 mg or 100 mg taken by mouth with or without food. If needed, a second dose may be taken at least 2 hours after the first dose. You may need a dose adjustment if you have liver or kidney disease. Do not take more than 200 mg of Ubrelvy per day, every 24 hours. It is not known if it is safe to treat more than 8 migraines in a 30-day period with Ubrelvy. If your migraine headaches are not relieved, call your healthcare provider for further advice and always follow their instructions. Are side effects common with Ubrelvy? The most common side effects with Ubrelvy that occur in about 2% to 4% of patients, 2 to 4 out of 100 people, are nausea and drowsiness. Serious allergic reactions have also occurred and may cause life-threatening anaphylaxis, shortness of breath, and dangerous swelling of your face, mouth, tongue, or throat. Get emergency medical help right away or call 911 if you experience these side effects. Ubrelvy also has important drug interactions. Do not take this medicine if you are taking medicines known as strong CYP3A4 inhibitors, such as ketoconazole, clarithromycin, or itraconazole. Ask your pharmacist if you are not sure. Have your healthcare provider or pharmacist check all of your medicines for drug interactions before you start treatment with Ubrelvy. Tell your doctor or other healthcare provider about all the medicines you take, including prescription and over-the-counter, OTC, medicines, vitamins, and herbal supplements. Also let them know if you eat grapefruit or drink grapefruit juice. Learn more, access the drugs.com drug interaction checker. This is not all the information you need to know about Ubrelvy for safe and effective use. Review the full Ubrelvy information and discuss this information with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.